Up until the 1800s, back pain was associated with evil spirits in some quarters. The introduction of X-rays heralded the first time healthcare providers were able to see inside a human body and look at a spine. Suddenly lots of things were found that people had no idea even existed. Now, fancy MRI scanners show us things in even more detail. But does it not make sense that of course these expensive machines are going to find stuff? It's not that MRI scans are never needed. There are some instances where they are needed and the findings are extremely helpful and relevant, but they are drastically overused in back pain. MRIs are great at giving us a picture of what our tissues tell us, but they don't tell us anything about pain. To put it bluntly, MRIs are machines that give us a lot of false alarms. It's not needed anywhere near as much as it actually is used, and these false alarms negatively affect your beliefs around the cause of the pain, so they actually do harm. It muddies the waters and sends people down a path of more medicine, more failed treatments and unnecessary tests. From my experience, it's hard for people to unsee what shows up on an MRI scan and makes reassurance that that finding isn't actually a problem quite difficult. The impact of an MRI report itself was studied. In a trial with 44 participants with low back pain for more than 12 weeks, everyone had normal age-related findings on their scans. In Group A, the findings were explained factually to the patient using typical medical language you would hear from your doctor or physio. In Group B, they were told these findings were normal and incidental. Both groups then received 6 weeks of similar conservative treatment and were then assessed in terms of pain, disability and function. The participants in Group A disimproved in terms of pain, disability and function and reported a sense of fragility and experienced negative thoughts and employed avoidant behaviour. Those who were reassured in Group B and were told these were normal findings and they didn't need to worry had less pain and disability, improved self-efficacy, as well as improved mental and physical health. Another study proved that radiologists and specialists read the exact same scan completely differently. A 63-year-old volunteer with sciatica allowed herself to be scanned again and again for science. It was like a sting operation. On average, each radiologist made about a dozen errors, either seeing things that weren't there or missing lots of things that were there. This begs the question, are MRI scans even reliable? Most findings signify nothing other than the power of modern medical scanning technology to scare you senseless, unless they are clearly explained to you in an easy to understand language and in the context of your stage in life. So apart from MRIs being overused, poorly read and very poorly explained, what can we say about the findings that actually do show up? Well, here's the main issue. Most of these findings also show up in similar people who have absolutely no pain. So scans will show up, they'll show up disc degeneration, disc bulges and arthritis. As you can see in the table below, these are normal age-related changes. However, they can really scare people and make people think they have a lot of damage in their back. Another issue is that what shows up on scans often doesn't correlate with the symptoms people are feeling. You can have people with scans that don't look good at all, with absolutely no pain, and people in horrendous pain with scans that look just fine. The key message is that just because your scan shows changes, it doesn't mean that that's what's causing your pain. It doesn't mean you have to hurt, and these changes don't need to happen in order for you to become pain-free.